Hello again, everyone, and welcome back to Reddit Aliens. I'm John, and as always, thank you so much for being here. Good topic, let's do it. Doctors of Reddit, what was your I can't believe I need to have this conversation with an adult story? Please remember to like, share, and subscribe.
Paramedic here. Was driving with my partner and patient in the back. Patient was fine. Patient's skeezy boyfriend was riding in the front with me and apparently saw a golden opportunity to ask a question that had obviously been on his mind for some time. Him. So when cats and dogs eat grass, that means they have cancer, right? Me. No, it does not. Made for an awkward, silent ride the rest of the way. Not a doctor yet, but an ER for 2 years. Mom comes in with her baby plus 2 more older kids. Complains that the baby hasn't pooped in a while and won't stop crying. As I'm settling them in with one of the nurses, the baby's bawling, like an opera singer lung bawling. Suddenly, Mom whips out a white plastic shopping bag and sticks an end in the kid's mouth, says this is the only way she stops crying. Nurse and I share a look and immediately order an emergency x-ray on the kid's stomach. Turns out, she'd ingested a good amount of these bags, and it was blocking up her stomach. Big deal, potentially life-threatening. When we confront the mom about her baby-feeding habits, her only words of defense are, well, I checked all over the bag and I couldn't find anything that said non-edible. TLDR. Mom had been letting her baby teethe on plastic bags because she didn't know they weren't edible. This won't be a long story. When I was an internal medicine resident, I came across a very nice 50-year-old Dominican lady. She was well-mannered, but one could tell she was not the sharpest tool in the shed. As I was prepping her chart for our first visit, I noticed that she'd been seen by every single digestive disease MD in our hospital system. Not only that, she's had every single procedure in the book, ranging from endoscopies up both holes and culminating in an exploratory laparotomy. You're opened up to basically look inside you when you have no clue what's going on. All of this because for years, she had basically one single complaint. She reported severe gnawing pain in her stomach. At this point, I should mention that she was Spanish-speaking only. Not only that, she had a very heavy Dominican accent, and I was the first Hispanic doctor to ever see her. My first language is Spanish, and even I had difficulty understanding her. So she comes in, and after exchanging some first-time pleasantries, I politely ask her how she's doing. Sure enough, although she was smiling and said she felt well, she pointed at her belly and said it was biting again, and asked for the cream to kill it. At this point, I got intrigued. Her medication list only mentioned a cream used for herpes breakthroughs. The previous fellow only mentioned in his note that in every single visit, she only asked for the cream and nothing else. When I asked what she meant by the biting and what she intended to do with the cream, she very calmly tells me she intended to stick the cream up her ass in order to kill the bird living inside her. After delving more deeply into her story, it turns out she didn't have a medical condition. Ever since she was a little girl, she believed that after eating a whole quail egg, the bird had spawned inside her and gnawed away in her insides whenever she was very hungry. After a short visit to psych, she was diagnosed with a somatic-type delusional disorder. No amount of medication or psychotherapy will cure her, but she was still a fully functional mother of 2 who paid her taxes and had a part-time job. I reached out to every digestive disease doctor in our hospital system once more to make sure she never receives an inappropriate invasive intervention. I've been following her now for 3 years, and she's happy as one can be, considering she has a bird living inside her. TLDR. Lady complains of pain in her belly. Worst case of lost in translation ensues. Gets very invasive medical procedures. Turns out, she's just a cuckoo. My SO is a med student. He helped to diagnose the 40-year-old woman who finally sought out a doctor after having open, festering wounds on her entire torso for over a year. The open wounds only appeared after more than a year of painful, visible lumps on her breast. She had never sought treatment prior to this. SO had to inform her that her entire body was riddled with cancer, that there was no treatment to help her, and that she would be dead very soon. Her sister, who was there the entire time, began loudly proclaiming what a shame it was that nothing could ever have been done, and that hopefully someday we would be able to detect cancer sooner. Significant other watched the doctor explain that pretty much any other woman in the country would have gotten effective treatment at the first sign of the lumps. This was during Breast Cancer Awareness Month. I saw a patient who was concerned because she was still lactating, despite the fact that she had stopped breastfeeding her twins 2 years ago. She said, "Sometimes I wake up in the middle of the night and find my husband sucking on my breast. He says he's trying to drain the milk from me." I had to explain to her that breastfeeding her husband will lead to continued lactation. I had severe asthma as a kid. I was intubated for a severe attack a few times. My parents were instructed to take better precautions in our home and went through instructions, more dusting, washing bed sheets, etc., and the big one, no smoking inside the house. So my parents agreed to all of this. A few weeks later, I'm back in the hospital. A doctor recognized me and came over to talk. Then he bent over and smelled my head. I'll never forget that. I thought it was so weird. He told the nurse to sit there and not leave me with my parents. When my parents showed up, he asked point blank, "Did you not understand what I told you last time? Do you understand these attacks could be fatal? But we opened the windows and have stopped smoking in her room when we put her to bed." Not a doctor, but my human sexuality professor in grad school had some interesting stories. He worked a lot in very conservative Christian communities, and so a lot of times people got married with no sex education. He had one couple who couldn't get pregnant. Turns out, they thought sleeping together literally meant sleeping in the same bed. Another couple was in therapy because neither of them enjoyed sex or ever had an orgasm. After having them talk through step by step what they did in bed, he learned the guy was just sticking it in and nothing else. He told the guy to move back and forth next time and see what happened. The couple came back one more time to say thank you and didn't need any more sessions.
So wait, you have to actually move when you do that? It's wild. Noted.
I saw a patient for a follow-up after 3 ER visits in as many days for asthma. He was from another country, so this was the first time I ever met him. His lungs sound absolutely terrible, but he swears he's taking the inhaler every 2 to 4 hours with no relief. This raises suspicion to me, as the same meds are working in the ER. I ask him to show me how he is using it. He holds it about a foot away from his mouth and does 2 puffs like Banaka and swallows. I felt really bad. He had never received any education about his illness or medications. I was living in China and taught English on the side to a student whose mother was a physician. This was in 2012, just prior to the London Olympics. The mother wanted to send her daughter to London with a school group to watch the Olympics, but had reservations about it. I asked why. She said she was worried that her daughter would catch AIDS from using the public toilets. Yes, a doctor. That coming to the ER for a pregnancy test is a very, very expensive way to do it. Apparently she didn't know you could just buy one at Rite Aid down the block. Seriously, don't come to the ER for a pregnancy test, because the test results won't be the only surprise you'll be getting. Also, if you have diabetes, then you need to take your medication. No, getting fatter isn't the worst that can happen. The worst that can happen is that you'll die. That's why you're in the ER with the diabetic ketoacidosis and suffering organ damage. It's why you're going to lose your toes. Take your goddamn meds. Not a doctor, but when I was in Afghanistan, a local man came up to me on patrol with his hand wrapped in a sheet. He was in visible pain and was asking for a doctor. So we got the medic to see him, and I helped unwrap his hand, and it was just fucking huge. He'd cut his hand very badly, and for whatever reason, kept it submerged in diesel fuel for 3 days before seeking help. His hand appeared to have soaked up a shitload of diesel. Or it was just an infected to F, but it resembled a water balloon, and lightly touching it caused it to piss liquid. It was nasty. I'm a paramedic, and recently transported an idiot who self-presented to the local hospital who found he was having a heart attack, STEMI, and needed him to send to a bigger hospital for treatment. During my assessment, I asked him how long he'd been having chest pain. On and off for 12 months, he tells me. Any family history? One of the biggest indicators. Oh yeah, dad died of a heart attack. Brother died of a heart attack. Both of them first presentation, stone dead on the spot. No effing about. So, you have a 12-month history of intermittent chest pain, and a family history of your closest male relative spontaneously chucking Hardee's and dying, and you've never got it investigated? Furthermore, the only reason you came to the hospital tonight is because your family badgered you into it. I told him he needed a solid kick in the ass. To his credit, he agreed. So I'm only an EMT, but I want to weigh in here to the conversation. I had to tell a patient with severe pneumonia and the patient's family that you don't get sick, i.e. catch a cold, by leaving your skin exposed. The family was vehemently debating me on the fact, claiming that I had no idea what I was talking about because I'm not a doctor. Attempting to explain to them the necessity for a foreign body to enter your system was the most preposterous thing to them. Nurse here, retired after 27 years on the job. The number of American 20-somethings that don't know if they're circumcised or not is surprisingly high. When one with urinary tract infection symptoms needs to give a specimen for testing, I ask, "Are you circumcised?" If not, I have to tell them to pull back the foreskin before peeing in the cup. The number of guys who have asked, "What's that?" is way too many. For the record, I can count the number who were uncircumcised on 2 hands. Had a patient in our high priority area for DKA. Sugar was in the 800s. Stomach pain, nausea, vomiting, and the such. Pulled Burger King and gummy worms out of his backpack and proceeded to eat them. Like, bro, do you even know what diabetes is? Non-compliance and lack of medical knowledge is a big thing in Detroit. CNA here. I did a patient's glucose the other day and it came back in the 500s. They were complaining of stomach pain and nausea, just really miserable. I reported the number to the nurse, and while we waited for the insulin, the patient asked me to bring them ice cream. Why? Their reaction was very clear once I told them what their blood sugar was at. They knew it was bad. Heck, they started crying, but then immediately asked for ice cream, because that'll totally solve the problem. I mean, I'm a biggish girl, and I'm no stranger to emotional eating, but when your blood sugar comes back so high that the nurse has to drop everything to come treat you, it's probably no bueno to reach for the sugar. The nurse and I were able to convince them to throw away the pile of crap they had on their table, soda, candy, piece of pie, etc., and that sugar-free applesauce was an improvement over eating ice cream. But man, the next day, they were right back to ordering pizza delivered to the facility and not checking a single fruit or vegetable on the menu. My job is to support the patient, but damn, it's hard sometimes. I can only positively encourage them to select healthy options so many times. If they don't want to eat their vegetables, I can't force them to. My mother helps the Amish get dental care. One Amish woman complained that she needed new dentures. When asked why she thought so, she replied, "Well, I've lost weight, and you know that when you lose weight, you lose it in your gums first." Doctors and dentists, if you're looking for a community to serve, the Amish can truly use your help. I could write a book about the things I've seen. My mother is a doctor. She once told me this story about a patient she had. She serves low-income people, so typically immigrants and minorities, usually without health insurance. This man is from Central America and is there for a normal checkup. Typical of most patients, he has fairly high blood pressure. However, this man is also having bowel problems, so my mother asks, "What color and consistency is your feces when you need to use the bathroom?" The man has no idea what she's talking about. My mom tries again, "Your poop? What color and/or consistency is it typically?" The man still has no clue what she's saying. He understands a bit of English. She tries again. "Your doo-doo? Nothing. Your fecal matter? Nothing. Your poo? Nothing. Not number 1, but number 2? Nothing." Finally, she asks, "Is not liquid when it comes out, but it's more solid, you know?" The man has an epiphany. "Oh, you mean shit?" He says, "Yes, your shit." So my highly educated professional mother has to continue the rest of the checkup asking about his shit. What color is your shit? Is it more wet? Does it hurt when you take a shit? This went on for a fair amount of time. My mom nearly burst out laughing by the end of it. Absolutely amazing what a minor language barrier could do. My brother is a general practitioner in rural Tennessee. Enough said, right? He says most of his patients' visits go about like this. MD. Well, person, you're pre-diabetic, have high blood pressure, and are complaining about joint pain. Have you been exercising and cutting out sugar and carbs? Person. Yeah, I have, doc, but it doesn't seem to help. Do you have any better meds you could prescribe? MD. Well, let's talk about your diet. How much water do you drink a day? Person. I don't like water, so I get extra ice in my sweet tea every day to make sure I get enough water. MD explains how that's not enough water by a long shot. How much sweet tea are you drinking every day? Those can have a lot of sugar in them. Person. Well, I get a large one from Hardee's or McDonald's, wherever on my way to work with my breakfast, and another one on my way home for dinner. Then I have a glass or 2 when I get home. MD. Well, that's a lot of sugar, and a lot of fast food if you're eating it twice a day. What do you eat at home? Person. I don't like to cook, so I usually don't eat anything but Little Debbie snack cakes at home. MD, those have a lot of sugar too. Person, I thought that all I had to do was cut out Mountain Dew. Now you're saying I can't eat my food or my snacks? What are you suggesting I do? Eat salad for every meal? Why can't you just up my meds? I don't know how much of this is true. It was my cousin, who's a doctor, who told me. He was in his first year in a clinic, and people went there to have an appointment because he was good-looking. Elder ladies loved him particularly. But this is totally unrelated, and the worst case was when this elder lady goes in with her granddaughter, around 8 years old. She had a severely infected wound in her head. Upon close inspection, he saw the wound crawling with small maggots, and the smell was terrible. He was pissed, of course, and asked why didn't she wash the wound and brought her earlier. She said she thought it would heal with time and was afraid to wash it, lest water enters her brain and kills her. There was also this woman that took her 6-year-old daughter there to check why she still didn't have pubes. Doctor here. I think the most frustrating I've seen since I was a resident was a very pretty, like stunningly pretty 17-year-old, what appeared to be normal, loving, affluent parents. She had a tumor in her pelvis, rhabdomyosarcoma, that we could resect to potentially cure her. The parents also declined chemo, and said they want to try holistic medicine because that made more sense to them. I last saw her 3 years ago. She was getting huge lymph nodes removed from her groin because they were unsightly. Obviously, metastatic disease. Parents did not want primary tumor removed and again declined chemo. I see 100 patients a week probably. Lots of devastatingly sad cases, but I still think about that girl, listening to her parents costing her life. But she's dead now. I can assure people doctors are not trying to swindle you, give you unnecessary care, or have some ulterior motive in this sort of setting. 99.99% of doctors are treating patients the same way they treat family, so try not to be dense. We want to help.